Hello, friends. Suzanne Hug here, coming to your home from mine. I'm a Mesa, Arizona business owner, mom of two, and a community leader. I'm running for the House of Representatives for Legislative District 25, and I'm asking for your support. This past week, I started the endorsement process with a group called Humanity Forward. It's the movement started during Andrew Yang's campaign for president that has now transitioned into being an action for those same progressive values and ideas. We share many of those same ideas. One of those issues is healthcare. And I know right now, everyone in the whole world is concerned about it. I'm right there with you. This is a scary time. We are living through a world event that will take thousands of lives. I have family who have gone in for COVID testing, and I know what it's like to wait for those results. So far for us, the results have been negative, and we're really relieved. But I know for a lot of you, that hasn't been the case. And for a lot of people, they're losing their loved ones and they can't even be with them. This is a very, very hard time. And I wanted to take a moment to really acknowledge that. That if you're out there watching me, thank you for giving me a moment of your time. And we're in this together. I know what you're going through if you're homeschooling, just like I am. Or if you're a business owner and you're worried about next week or next month's bills. May 1st is just around the corner. And for a lot of people, paying their mortgage, making those bills, it's a really scary time. But I do want to talk about just health insurance, that little piece of this right now. Because we don't just rely on our personal health insurance, on what you may have through your job or through the Obamacare, or however, or maybe you're just not even insured. No matter what kind of payment method you have, we rely on the whole healthcare system in our community. We rely on having a hospital nearby. But a lot of areas in Arizona that might be rural may not even have a hospital. In urban areas, like in Maricopa County, a lot of times the hospitals are overwhelmed even during good times. Before this crisis, I was talking with members of our veterans community about how the VA doesn't serve their needs. We already had a mental health care crisis, a suicide crisis, and even just getting basic services to our veterans who have already given so much for our country. Our country was already facing a mental health care crisis, as well as an opioid crisis. And now, nationally, but globally, as a people, we're going to be adding another trauma to that. And that's a lot. And it's overwhelming. But we deserve to have leaders who are ready to step up to that call of duty and who are able to plan and think about our futures as a whole. We need to plan to take care of ourselves, but also our communities in the coming weeks and days and months and years. That's one of the places I really agree with Humanity Forward, that we need to put people at the center of our recovery. And we need to focus on healthcare for all. My approach has two main parts. First, we need to get more people into the healthcare industry and work. It'll make jobs for people, really good jobs, and that will help get money flowing into our economy again. And second, we need to legislate basic healthcare for all. An example of that, something we have in Arizona right now, is our state immunization program. Right? Kids under 18 can get free vaccines. That's what it promises, and that's what our taxpayer dollars that were put in that program are meant to do. But those free vaccines are only available at a few special clinics during 9 to 5, Monday through Friday type hours. And for a lot of families that might not have transportation or the work flexibility to be able to get there, that means that their kids don't get vaccinated, even if they want that, even when they're available. We have a service gap. We need to be expanding those programs and to create public and private partnerships that gives access for every neighborhood through their local doctors. I support our doctors and nurses. They are doing hard frontline work on a daily basis when there's an epidemic or a pandemic and when there's not. They deserve to get paid for that hard work. And the government should work hand in hand together to make sure that we're getting healthcare to our communities and supporting our doctors and nurses and the people really doing the work. That's how we keep Arizona healthy. We need to be learning from COVID-19 and doing a better job fighting for our health in the future, not just when it's the crisis of the moment and demands our attention, but when we look at overall, what makes our community better? Where should our priorities be? And who should we be serving? We need to put people at the center of that. We need to be talking about and treating mental health care, treating our veterans issues, making sure our kids all have vaccines, not just for COVID-19, but for the seasonal flu and for all of those other childhood illnesses that we have, by and large, wiped out as a community. I mean, nobody wants to go back to medieval diseases. I've got my kids fully vaccinated. And even a few weeks ago, I had to get a tetanus shot because I had stepped on a nail when I was out doing some gardening. These are vaccines that are part of our daily lives and keep us all healthy. And that's really what I want. I want to see all of us healthy and happy and prosperous. Thank you for sharing a few minutes with me. Please let your friends know about my campaign and make a donation if you're able. $5, $10, $50. It really helps, especially if you can make it monthly. Take care of yourself and your loved ones. I wish you all the best. Please feel free to visit my campaign page at hug4house.com or to follow me on social media. I'm on Twitter, I'm on Facebook, and of course, I'm on YouTube here. My name is Suzanne Hug, and I am your LD25 candidate for House of Representatives in November. Thank you so much, and I'll see you next week.